CSU students were used as paramedics for these demonstrations. Hi there and welcome to this Charles Sturt University skills video of how to run a resuscitation. This video is a part of a series of skills videos designed for our paramedic course to assist teaching the practical skills components of our degree program. You'll be able to apply these skills when you are practicing as a paramedic in the field. Okay, so let's first look at the initial steps required before you get going. Before going into a scene, always make sure you have the correct gear. This is critical to running a successful resuscitation. Check you have your radiator core for backup and you give a sit rep. Make sure you take your defibrillator with you and that it has spare battery. Take your other kits with drugs and airway adjuncts as well. In this video, you'll see that the crew are taking the gear into the scene with them. You've assessed that there is no danger and can confirm the patient is unconscious. Their airway is clear. If it is not, you should fix this issue first. You check the patient is not breathing for 10 seconds. You confirm the patient has no pulse. Now is the time to call for help if you have not already done so. In most circumstances, the paramedic crew would contact their communications centre asking for a backup vehicle. Having more hands, a minimum of 3 paramedics will make the situation more manageable. Think about your placement of gear and place it conveniently and accessibly. You'll need to have clear access to the monitor to be able to use it, and you want your airway adjuncts and drugs in places that will be easy to reach. At this point, one paramedic should begin CPR at a rate of 30 to 2, while the other sets up the monitor and attaches the defibrillator pads. Open the pocket and take the defibrillation leads and pads out. Check to see if the patient's chest is wet or overly hairy. You may need to dry the chest or remove excessive hair prior to placing the pads. Once you can confirm the chest is dry and you have access to the skin, open the pads from their packet. Place the negative pad to the right upper chest. In many people this will be just below the clavicle and down across the pectoral muscle. To help you, there is a picture on the pad of where it should go. Take the second pad, which is the positive pad, and place it on the left chest wall in the lateral aspect, just on the mid-axillary line. This is below and to the left of the pectoral muscle. Again, there is a picture on the pad to help you with placement. Finally, the pads should be smoothed on to make sure there is a good connection. In the situation of placing the defibrillator pads on a child, the optimum placement would be anterior and posterior chest placement. This may also be optimum placement for an obese patient. Now you want to turn on the machine by pressing the green button. The machine should default into pads mode due to picking up the signal from the pads cables. The rhythm we see displayed here on the screen is ventricular fibrillation. This rhythm is shockable when your patient has been confirmed as being in cardiac arrest. Note, if you see this rhythm on the screen and your patient is conscious or not in cardiac arrest, you should not shock the patient. You will press the charge button and the machine will charge to the setting that is the default for your ambulance service. You will see the machine charge to 200 joules. You will use the command for your partner to stand clear, and you will visually check that no one is touching the patient. One option is to sweep your hand above the patient as you ask all people to stand clear. Once you have confirmed that no one is touching the patient, you can press the shock button, delivering 1 shock to the patient. Of note here is that it is safe to continue compressions whilst the machine is charging. This also helps to eliminate the hands-off time between compressions. Energy delivered will be displayed on the screen, and you are to go straight back to performing compressions without feeling for a pulse or rhythm check. You will perform 2 minutes of CPR even if the rhythm has changed on the monitor, as a pulse is not often felt straight away following even a successful defibrillation. Remember that the optimum time for each rescuer doing compressions is 2 minutes, so you should swap with your crewmates every 2 minutes to help combat rescuer fatigue. Now is the time, if you have enough rescuers, to insert an IV cannula and to place an LMA or other advanced airway if you are working with a paramedic who has this skill level. If you are the second crew arriving as backup to a cardiac arrest, it is an excellent idea to bring in spare equipment, items such as oxygen, defibrillators, and possibly a backboard for extrication. One crew member should attempt cannulation now, while the other continues CPR if required. You may also have time here to insert an LMA for airway control. When you are making your way towards 2 minutes of CPR, you should be recharging the machine in preparation for defibrillation. This is usually done within the last 15 seconds of CPR to avoid waiting for the charging time. Let your partner know that you are not going to shock them, but you are just preparing the monitor. Once the machine is charged and you have completed the 2 minutes of CPR, you are ready to assess the rhythm. In this case, the patient is still in ventricular fibrillation. Ask the crew and bystanders to stand clear, sweep your arm over the patient to confirm. Once you are satisfied, you can press the shock button and deliver the shock. Once this shock has been delivered, you would swap the rescuer who is performing CPR due to the possibility of fatigue. This is the time now that the crew would start applying their drug interventions to the patient. If you have an intensive care paramedic on scene, they may choose to intubate the patient. The intensive care paramedic will decide if the patient requires intubation or not. You'll now continue on with your cardiac arrest treatment as per the service provider's guidelines for whom you are working.